Thank you very much. Thank you. Good afternoon, everyone. We'll get going with some of the numbers. Boy, we had a bit of a jump today, 2,380 cases, although about 300 of those cases were due to lagging reporting. But in any case, it's still a jump from what we've had. Again, Toronto leading the way. They had 1,016 cases reported. Peel and New York. Ottawa had 152. That was a big jump there. As you know, they're still in the red zone. And In terms of our local numbers, again, we continue to see increases in our area. Uh, Again, I gotta find where we are here. Hold on. Sorry about that. Here, sorry. Yeah, so we continue to see. Oh, sorry, let me just. There we go. Increases in our caseload. Again, it seems to be sort of going on an upward trend, although slightly less today than it was from yesterday. If you recall, the numbers that went between Tuesday and Wednesday, we were up 45. Today, we're up 29 from the previous day, 16 in Prescott Russell, 8 in SDNG, and 5 in Cornwall. Most of these are from outbreaks in Prescott Russell. And so if we look at the rolling average, again, we're really in the red zone here. Although there's a bit of a slight tendency to decrease, but you could see we're way up in the red zone. And so if you combine these with our R naught, which is 1.5 right now, the reproductive number, and with our positivity rate, which is 2.8%, all of these parameters are really red territory. So tomorrow we will be put into the red. There will be an announcement by the they usually do every Friday, and it'll be effective on Monday. And so, unfortunately, we are going to be going into the red. There's no doubt about it. And I'm just hoping that we can quickly start recovering and going back to the orange. So the other thing that I wanted to share as well at this point is the fact that we've had in our area 137 of our cases are essentially variants, and all but one are UK. One we just got a confirmation was a South African variant, but the majority of the variants are UK in our area, and our percentage of positivity is 52%. Of all tests that were positive are positive for mutation, and we know that the provincial average is about 55%, and we've been seeing a slow increase in those numbers. In terms of other things, hospitalizations, while it shows that we've got right now, although there's a bit of a discrepancy there, but we're going to correct it. We have 26 patients hospitalized and 3 in the ICU at this point in time, and we have 8 outbreaks. Again, the majority of the outbreaks in our congregate living are stable. McConnell is still an outbreak with, again, 5 active out of the initial 13 positive residents, and we've had 3 active out of the initial 13 positive staff. Again, continue with our procedures. Everything else, really, the palace was closed in terms of an outbreak on the 23rd, and everything else, really, all the other outbreaks that we have in congregate living settings for the seniors have no residents and they're more staff. And just wanted to outline that we just want to make it clear that we have vaccinated all residents in long-term care and retirement homes only. We will, as you'll see later, progress as phase 2 to do other like lodging homes, group homes. But at this point, we've only vaccinated long-term care and retirement home residents only, and continuing to vaccinate the rest. Now, in terms of Other things that that are going on. Because of the numbers that we're getting, our staff again is being overwhelmed. As you recall, we had 72 over the weekend. It was 72 we added over the weekend, by the way. There was a bit of a discrepancy. So we added 72 over the weekend. And then, over the last couple of days, at least another 60 or 70. So you could see a lot of cases. We are sending some to the provincial workforce through Public Health Ontario and Stats Canada. And so we're just telling people, if you do get a call from us and telling you that it's positive, and we'll call you back. We may call you the next day, but we will call you back. It's just that we're so backlogged, and that's what we mean by overwhelming our contact tracing. At this point, like I said, we're managing, but barely, and so we just want to ensure that people know that we will be calling and following up for the contact tracing. In the meantime, obviously, if you're told that you're positive, or if you're told that you are a high risk contact, please remain home in isolation. And to us, that's very important that you continue to do so. In terms of the rest of this talk, what I want to do is I want to give you a bit of an update on vaccines. I'm getting a lot of questions about vaccines, and I just want to share a few slides with everybody here. And so just I want to give you kind of an update of where we are. Obviously, we're in still phase one, and as of actually today, as of the 25th, like I said, we've done all that. We've delivered the doses to the residents of long-term care retirement home, continuing with healthcare workers, central caregivers, first responders responding to medical calls, and so on. Adults receiving home care. We've started the 75 plus population this week in terms of booking. And again, we're going through our 37 scheduled clinics, 14 of which are in Cornwall, and we've booked over 11,000 appointments so far. In terms of what's going to be happening, I'd like to just so we just received our with this week's dose on Monday or Tuesday this week. We received about 4680 doses at that point. Yeah, 4680 doses. So total so far, we received about 28,000 doses. And total as of yesterday, we've administered about 22,000 vaccines in our area. And we did over 7,640 over the last 12 days or so. We are expected to get another, for the next couple of weeks now, 5,500 per week. And so actually for the next 3 weeks, so it'll be about another 15,000 or so, 16,000 or so moving forward. We are having a meeting this afternoon with the general to see what our allocations will be beyond that, the 9th, because the 9th to 12th is our last kind of week that we have to plan. Just very quickly, just wanted to go over some phase two. And again, phase two is not starting yet, but people are asking us, how will we let them know? Obviously, when we change age groups and go to other areas, we will be using multiple ways of contacting people. We'll be using media and so on. So I just want people to know that we'll do our best to make sure everybody knows that that it's their turn. In terms of the next steps, just very quickly, once we go into phase two, which we again hopefully it'll be done in the early April or so, we'll be looking at the remaining congregate care settings, like I said, lodging homes, group homes, those type of things. Essential workers then in terms of teachers, workers responding to critical events, enforcement agencies, farms, funerals, and so on, and then going to the other workforces that will include obviously essential critical retail workers, grocery, food banks, non-clinical pharmacy workers, Service Ontario, general goods stores, and restaurant workers as well, and personal service services as well in there. And there's a whole slew of others moving forward. So I just wanted to give people an update of where we are. We are proceeding, and as we get more vaccine, we'll be opening it up more. Last week, I went over the sites. We are now looking at other sites as well, in addition to our mobile clinics. We're now looking at having extra pop-up clinics in Embrun and Plantagenet and other areas, and also looking now at drive-throughs as well. So we're looking at multiple areas. We're obviously trying to reach out to individuals that are homebound. We're going to go to their homes and vaccinate them as well. we're going to be eventually, getting into pharmacies. At this point, I've been asked a question. No, we do not have AstraZeneca yet in our area, and at this point, we have no pharmacies yet. We haven't been informed of such. We're trying to get more information of when we'll be getting, stock to vaccines in our pharmacies. We're also going to be working with our primary care providers as well, doctors and clinics and so on, as we get more vaccine, so we can start vaccinating their chronic disease patients. Because don't forget, people with chronic disease, elderly 60 to 79, and the essential workers are all in the second phase, which will be a long, large phase, which will be a lot of people in that phase. But we will be, like I said, ramping it up as much as we can based on our supply. So hopefully we'll get some updates tonight. I want to make a comment on our vaccine appointment system. Again, when the ministry changed last week, as you recall, there were error messages when it opened on the 15th, and then they got sorted out, and they had missed some of our clinics. They hadn't put all our clinics in. And then it settled down. And then again, on Monday, when they changed it to 75, again, many of our clinics were dropped, were not there, or some were clinics, some people couldn't book, some people couldn't book a second appointment. Anyway, there was a whole slew of things. We've been working with the ministry now for the last couple of days. And finally, I think late last night, it's been resolved. And we tested it this morning. And it seems that all our clinics are in there. Our Hawkesbury clinics, our Winchester clinics, everything is now back in on board. Because like I said, we had submitted 37 clinics and not all of them appeared. And so I believe that that's rectified. So please try again. Like I said, we do have room, and we do have vaccine for you, particularly in those age groups, 75 and over, and obviously in the other categories of phase one. So, and as we change those, and as we change different age categories, of course, we're gonna do our best to inform people. The other thing that I just wanted to say as well is that we're working with multiple agencies and partners, including our emergency managers of all our 17 municipalities, to ensure that transportation is provided. Prescott Russell is helping us. SD&G is helping us. City of Cornwall has provided free busing for the vaccinations to people who can't, who don't have a car. So it's very important. I'm just very grateful that that's happening. It happened with H1N1, and I'm very grateful that it's happening this time around. So things are looking good. Our numbers are going up in terms of vaccinations, but our numbers of COVID are going up as well. So again, can't stress the importance of following strict measures. Most of these cases that we're seeing, again, are close contact, household contact, social gatherings, workplace gatherings. I'm talking about employees in the back. That's what we're seeing. Then they go home and they infect the whole family. And then the child goes to school, and then the child, brings it to the school. So again, it's just that vicious cycle that we've been seeing over and over again. And so please, that is sort of it's very important right now that we start decreasing those numbers, so we can then really concentrate on our vaccine moving forward. Okay, so I'm just. I think I'm done there. Donc, bonjour tout le monde. Je vais commencer avec les statistiques provinciales. Je vais juste changer un petit peu mon... voilà. Attendez, je vais juste arrêter ici. Donc, en Ontario, on a eu une hausse, je pense, pas mal importante, 2380 cas de plus aujourd'hui ajoutés. Il faut dire que la moyenne était à 1500 à peu près, donc on a augmenté pas mal. En effet, il y avait 300 à peu près qui étaient ajoutés à cause des problèmes de logiciel il y a quelques jours, mais quand même, c'était une augmentation importante avec Toronto, Peel, York, la plupart, mais Ottawa aussi a augmenté à 152 cas. Comme vous savez, Ottawa est dans la zone rouge. Nous, dans notre région, je vais partager mon écran. Voilà. Et nous, dans notre région, nous avons presque 300 cas actifs actuellement. Nous avons 8 flambées. Nous avons en effet ces 26 patientes hospitalisées avec 3 soins intensifs. Ça va changer dans l'après-midi. On n'a pas eu le temps de le changer. Et nous avons ajouté cette fois-ci aujourd'hui 29 cas aujourd'hui. Et nous avons ajouté hier 45 cas. Et si vous vous souvenez bien, la fin de semaine, on a ajouté 72 cas. Donc, pour clarifier, c'était 72 que nous avons ajouté la fin de semaine. Donc, vous pouvez voir, on a pas mal des cas qu'on a ajoutés depuis les dernières 5-6 jours. Au niveau de la moyenne mobile, qu'est-ce qu'on voit? Clairement, nettement, on est dans la zone rouge ici. La ligne est ici. Donc, vous voyez tout, la moyenne de bureau de santé de l'Est Ontario, Prescott Russell, SDG, Cornwall, on est tous dans la zone orange. Rouge, orange est ici, vous voyez une grande différence. Et aussi, nos taux de reproduction et le taux de positivité est dans rouge aussi. Donc, à cause de tout ça, toutes les données qu'on a, on est clairement dans la zone rouge et demain, ça va être annoncé de façon officielle qu'on tombe dans rouge lundi matin, lundi prochain, le 29 mars. Et je pense qu'on va rester là pour quelques semaines à peine juste pour oh boy. J'espère que ça va juste quelques semaines, mais après ça, ça va diminuer. Mais par contre, ça serait très important là pour qu'on puisse continuer à respecter les précautions de santé publique. Il faut dire aussi que parmi les cas que nous avons dans notre région, 52 sont des variantes. On a 137 en total et sur les 137, une est le souche Afrique Sud et les restants sont le souche britannique. Donc, bien sûr, c'est un peu décevant, c'est un peu inquiétant qu'on tombe dans la rouge encore, mais on voit ça à travers l'Ontario. Donc, j'espère qu'on pourrait continuer qu'on verrait une diminution d'ici 1-2 semaines. Je pense qu'on va dans le rouge pour au moins 2 semaines, puis on va réévaluer. J'espère que ça va en diminuant, pas en augmentant. Au niveau des éclosions que nous avons dans les hôpitaux, dans les maisons de retraite et à longue durée, il n'y a pas beaucoup de changements. En effet, Palace, il n'est plus en occlusion. La seule qui est en occlusion avec des résidents qui étaient positifs était Chartwell McConnell Manor. On a toujours 5 actifs sur les 13 positifs au niveau des résidents et nous avons toujours 3 actifs sur les 13 originales employés qui étaient positifs. Encore, on a la variante dans cette éclosion. Les autres occlusions n'ont aucun résident dans notre région et c'est plutôt les employés. Donc, je veux juste souligner aussi que nous avons tout vacciné les résidents des maisons de longue durée et des maisons de retraite seulement. Les maisons de groupe, etc., les lodging homes vont naître à la prochaine étape en phase 2. Donc, je vais tomber un petit peu maintenant de parler de meilleures nouvelles à cause qu'on a une bonne progression avec nos vaccins dans notre région. Je vais juste trouver mon diapo ici. Donc, ça va bien au niveau des vaccins que nous avons actuellement. Par contre, on est limité à cause des chiffres de vaccins qu'on reçoit. Jusqu'à date, juste pour donner un petit sommaire, nous avons donné tous les vaccins, comme j'ai dit tantôt, aux résidents de maisons de longue durée et de maisons de retraite. Nous continuons à donner les vaccins aux travailleurs de la santé, les personnes qui donnent les soins, les premiers répondeurs, etc. Et les 75 âges et plus, on continue à le faire. Nous avons 37 cliniques de bouquets d'ici la première semaine d'avril. Les 14 sont en Cornwall et nous avons au moins 11 000 et plus personnes déjà qui ont pris des rendez-vous de nos systèmes que je vais parler tantôt. Au niveau où on est rendu maintenant, avec nos chiffres des vaccins qu'on va recevoir jusqu'à date, incluant la livraison que nous venons de recevoir. On a reçu à peu près 28 000 doses en total et nous avons vacciné jusqu'à hier 22 000, à peu près 20, on avait donné à peu près 22 000 doses, plus que 7 500 a été dans les dernières 12 jours à peu près. Et nous attendons de recevoir à la moyenne 5 500 pour les prochaines 3 semaines, jusqu'aux premières semaines d'avril, entre le 9 et 12. Et on s'attend du ministère pour avoir un peu plus de détails au niveau des allocations qu'on va avoir pour le mois d'avril, en mois de mai. Comme ça, on pourrait encore planifier pour une autre tranche de 4 semaines qui va être rentrée dans le système de réservation. Bien sûr, le phase 2 va inclure les personnes de 60 à 79 ans, les personnes qui sont dans les maisons de groupe, etc., et aussi les personnes qui ne peuvent pas travailler à la maison, ainsi que les personnes avec les maladies chroniques. Au niveau de personnes qui ne peuvent pas travailler à la maison, c'est les enseignantes, tous les personnels des écoles, les garderies, les personnes qui répondent aux événements critiques, comme par exemple policiers, etc. Et après ça, on aurait les personnes qui travaillent dans les maisons, dans les épiceries, pharmacies, tous les magasins de détail, etc. Donc, on a une liste qui est pas mal longue. Et ceci va commencer, espérons, le mois prochain. On n'est pas sûr encore les dates. Donc, vous voyez, on a pas mal des groupes qui vont être vaccinés au même temps dans plusieurs endroits qu'on va choisir bientôt. Je vais juste parler un petit peu du système de rendez-vous. Il faut dire qu'on avait des problèmes techniques dès qu'on a commencé le 15 mars. Et il y avait des erreurs. Il y avait aussi des cliniques qui manquaient de Cornwall et Hawkesbury, surtout, et Castlemaine. C'était réglé la semaine passée. Et maintenant, encore décevant que dès le lundi passé, qu'on a changé pour les 75 ans et plus, encore, on a manqué des cliniques dans notre région, pas mal. Beaucoup de cliniques à Cornwall, Hawkesbury aussi. Winchester, il montrait que c'était fermé, mais c'était pas. On avait beaucoup d'espace. Et aussi, il y avait des difficultés à prendre les rendez-vous, à booker les rendez-vous. Donc, il y avait pas mal, c'est pas juste nous, c'était Ottawa et les autres régions d'Ontario qui avaient des problèmes. On était sur téléphone continuellement avec le ministère pour que ça soit réglé. Finalement, c'était réglé hier soir. Donc, je vous encourage de continuer à utiliser le système pour qu'on puisse combler les prochaines semaines. Et dorénavant, on va ajouter des différents groupes. Une fois qu'on ajoute les groupes, on va sûrement aviser les gens par plusieurs façons pour qu'on puisse vous tenir au courant de tout ça. Avec les vaccins que nous allons recevoir dorénavant, qu'on espère va être une débit un peu plus élevée qu'on aurait les dernières 4 semaines. So I'm going to go into some of the questions that I have here. Canadian Presse, details on elevating from orange to red. I think I've explained that. Essentially, all our indicators, both in terms of 7-day rolling average, in terms of our hospitalizations, in terms of our positivity rates, and our reproductive number are all in the red zone at this point, clearly in the red zone, not even borderline. Last week, we were up in the red zone, but closer to the orange, and we were hoping that we'd have a downtick, but unfortunately we did not, and we will be going into the red zone tomorrow. The question here about we put case acquisitions and percentages of where they were on our website. Actually, that's as of September 1st. That's when we switched the CCM system, so we could withdraw that information. I've answered the other questions. About that, and I have another one en français. Combien de temps en moyenne doit-on prévoir avant d'obtenir les résultats d'un test de dépistage? D'habitude, maintenant ça va un peu plus vite. Le plus, c'est 48 heures. La moyenne, c'est 24 heures qu'on a des résultats. And that's all with the questions that I have here, Jenna. So let's open it up to questions here on the call.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul. Ottawa moved to red 24 hours after making the announcement.
Yeah.
announcement is coming later today, you said. Why wait till Monday, especially since the red now allows non-essential retail and restaurants to still have people inside?
First of all, restaurants the red will still have people inside. So
Yes.
it's not much of a change there.
Right,
The
so-
red changed last week. The retail is not much of a change into red, except the grouping, which is five. It goes from, the 50 out and 10 in and 100 in. And then for gatherings, it's a different number, but it's 5 and 25 for everybody. That's the most important one that changes. I thought about that, Philip. I spoke to the chief medical officer of health about that, like putting the brake on earlier. But in all fairness, I wanted to give the people a bit of a couple of days runway notice for it, because some people criticize if you do it one day and you just close everything off the next day, it's too abrupt. So I just wanted to give people a bit of a chance.
Okay, and you said on Monday that it was all hands on deck with most of the staff now working on contact tracing or vaccinations. Does that include food safety inspections for restaurants and school nurses that were hired to work in schools this past fall?
The school nurses are continuing to work with the schools. That's what they're doing. But the food inspectors are helping, but they are doing compliance checks and complaint checks as well. For food and restaurants as well. We're not doing the full routine, but where we can and where there's a complaint, we will follow up.
Okay, and lastly, would you say that we are in a third wave?
You know what? I think we are. I see it going up. I see it going up slower. But if you separate, Philip, just look at the VOCs. Yes, the VOCs on its own is causing its own wave.
Okay, thank you.
You're welcome.
Next question, Natasha Wood, Nation Valley News. Please go ahead.
Hi, Dr. Paul.
Hi.
I have some questions from Nelson, so don't blame me for these ones.
Okay.
What is the point of rapid testing at Dundas Manor if everyone there has already been vaccinated?
Okay. Dundas Manor. When was that done?
I think there's a temporary citizen care pod there.
If the testing is still continuing for staff and for visitors, it's not for residents, as far as I know. We have vaccinated them. We have not vaccinated all the staff though.
Oh, okay, that makes sense.
And we're continuing. So that's continuing now. The retirement homes and long-term care homes require staff to be tested every couple of days, depending if you're the frequency of which depends on whether you're orange or red. And so that's where we're continuing. But it's not the residents. We're not testing the residents.
Okay. And the second question is, why is rapid testing only available 3 days a week at Dundas Manor? Isn't that a little like having a smoke alarm that only functions 3 days a week?
No, because first of all, you don't test everybody all the time for nothing. The testing, the rapid testing that it's done now and others is the pan bio, and if you do it one off, it doesn't work. If you do it every day, it's probably better. But if you do sequential 2 to 3 times a week, you will not have high false negatives. That's why we're doing it. So there's no, if you do a couple of times a week, it's reliable. If you do it every day, it's a pain. And so we're trying to find the balance between the two.
Okay, thank you so much. Have a great day.
You too.
Next question, James Morgan, The Review. Please go ahead.
Doctor, I have a question here. Do you have any sort of advice for people who are going to vaccination clinics in terms of how and when they should show up? I've heard stories about people showing up much earlier than they necessarily needed to.
Yeah. Thanks for bringing that up. I think I brought it up a couple of media briefings ago. 2 things. Number one, make sure that you download our consent form. What happened was with the ministry appointment system, it doesn't remind you, it doesn't tell you you need a consent form. Mm-hmm. So that backs us up a bit. And so now we're hoping that people can, go to our website and download the consent form and get it done beforehand. It's much quicker. And the ministry apparently will be putting a reminder in and a link to their consent form. So that's one thing. But yes, we recommend people to show up 5-10 minutes max before the appointment. We've had people show up an hour and a half earlier, and it really creates a backlog. So yes, thank you for bringing that up, and it's a good reminder. Je veux souligner que les gens qui devront qui ont le rendez-vous pour le vaccin, s'il vous plaît, présentez-vous seulement 5 au maximum 10 minutes avant votre rendez-vous, parce qu'autrement, on a des files d'attente pour le rien.
Prochaine question, Denis Babin, Radio-Canada. C'est à vous.
Bonjour, Dr Paul.
Bonjour, Denis.
Vous avez abordé tout à l'heure les problèmes là, avec le système de prise de rendez-vous vécu par des gens qui essayaient de réserver des plages horaires, notamment à Hawkesbury. Sait-on à quoi c'est dû, ça, ce problème-là?
C'était dû à on avait donné tous les chiffres, tous les cliniques, et apparemment, on a tout donné, on a vérifié, parce qu'on a 37 qu'on a donné, Denis, et pour une raison ou l'autre, à cause le transfert technique n'était pas bien fait. C'était une erreur du ministère, il y avait un bug dans le système qui ont réglé, donc ça n'a pas pu tout transférer les données que nous avons données. Donc, le transfert était mal fait, si vous voulez, à cause des problèmes techniques. Mais semble-t-il qu'il y avait beaucoup de bugs. Donc, ils ont finalement le réglé. Et je n'ai pas entendu depuis midi que ça ne va pas bien. Donc, je pense que ça va bien. J'espère, on va vérifier, mais je n'ai pas des appels parce que normalement, on reçoit des appels que ça ne marche pas.
Donc, vous avez demandé et vous encouragez les gens justement à réessayer de prendre un rendez-vous. Là.
Oui, s'il vous plaît.
Parfait. Est-ce que votre calendrier de vaccination là, avec les cliniques de vaccination massive, est-ce que c'est disponible en ligne?
Non, c'est pas disponible en ligne parce qu'on veut. De notre côté, ce n'est pas un secret, mais on ne veut pas que les gens se présentent. C'est justement juste par rendez-vous. Donc, c'est pour ça qu'on ne le met pas en ligne, Denis. C'est la seule raison. Il n'y a rien à cacher, là, mais c'est juste pour ça.
Dernière chose, pouvez-vous reprendre lorsque vous parliez justement de la troisième vague, évidemment, du rôle joué par les variants?
Je pense que oui, Denis, si on sépare et si on fait ça de façon provinciale, si on sépare les souches originales contre les souches de variantes, on peut voir que le variante augmente de façon beaucoup plus élevée. Donc, on voit que c'est une tendance d'une troisième vague, surtout avec les variantes qu'on voit.
Merci beaucoup.
Pas de problème.
Next question, Bill Kingston, Newswatch Group. Please go ahead.
Yes, hi, Dr. Paul.
Hey, Bill.
Hi, I just wanted to ask you, Dr. Kieran Moore from the Kingston Health Unit did a very public PR of him getting his first shot of the vaccine, being AstraZeneca, to allay fears and skepticism in the community, which brought me to ask you a few questions. Have you had the vaccine? If so, what was it? And if not, are you waiting for the time that you may get AstraZeneca to allay those skeptics?
I had my vaccine very recently, and it was Pfizer. We didn't have Astra at the time.
Okay. That's all my questions.
Again, but if I had Astra, I wouldn't hesitate. It's just that we had it there, and that's our health unit is being vaccinated, and I'm going to be a potential vaccinator at some point if necessary. So, but in any case, I wouldn't have hesitated with Astra either. It's just that we didn't have it here.
Do you think you're going to get Astra?
I'm not sure. It may just go to pharmacies at this point, so we're not sure yet.
Okay, perfect. Thank you very much.
You're welcome.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. We have one more question from the chat box, Dr. Paul. Annie-Rose Deschâtelet, Le Droit. C'est à vous?
Bonjour, Dr. Paul.
Bonjour.
J'ai une question par rapport au décès. En fait, sur le site du BSEO, ça indique qu'on est à 69 décès depuis déjà plusieurs jours. Mais l'hôpital de Hawkesbury a envoyé un communiqué aujourd'hui par rapport à l'éclosion et il indique qu'il y a eu 5 décès liés à la COVID à l'hôpital. Pourquoi ces décès-là ne sont pas encore indiqués sur votre site?
Parce que ça prend des fois 24 heures avant que notre système le prend. Donc, c'est pour ça que j'étais au courant et on va les mettre parce qu'il y a un délai entre le système c'est technique, c'est une question technique. Ils vont apparaître demain, probablement.
Donc, vous pouvez confirmer qu'en tout, si on ajoute les 5 décès, il y a donc 74 décès dans l'estomac.
Si on rajoute les 5, oui.
Merci.
Those are all the questions for today, Dr. Paul.
Thank you.